Evening, everyone, and welcome to PCCP's chapter session on advocacy entitled Building Resilience for Healthcare Workers During the COVID-19 Pandemic and Beyond. To start off, let us please hear a few words from the chairman and the committee of chapters, Dr. Eileen Aniceto, for her opening remarks.
Hello, hi Radha. Good evening, Park, and good evening to everyone. So, welcome to the first, actually, I think this is the first advocacy activity that's chapter initiated. So, I'd like to congratulate the Southern Mindanao chapter for being the first for this particular initiative of the chapters. So this is really very relevant because of all the populations, I guess, during this pandemic, the healthcare workers are the most vulnerable or high risk for post-traumatic stress, anxiety, depression, and sometimes we just don't recognize it. So I'm hoping that this particular webinar will help each of the healthcare worker currently attending and in the future. Since we'll be showing this regularly, that it can help a lot of healthcare workers. So thank you for making this topic your topic for tonight. So welcome everyone.
Thank you, Dr. Aniceto, for welcoming us. Now let us hear a few words from the president of the Southern Mindanao chapter of PCCP, Dr. Iris Ruth Batalla, for her welcome address.
Good evening, everyone. Wow, there are 79 attendees. Congratulations, Dr. Mansukhani. In the past year, we have been listening to so many lectures on how to manage and take care of our COVID-19 patients. Tonight, for a change, we will listen to a lecture on how to take care of ourselves and how to manage our own anxieties and stress during this pandemic. The number of patients keep rising, but the number of hospital beds and doctors remain the same. So we cannot give up. We have to stay resilient. So tonight, our lecturer will teach us to be just that, resilient. I pray that we will all remain healthy and our families will be safe. Good evening and thank you.
Thank you, Dr. Batalla. Just like they mentioned, we are currently seeing an overwhelming increase in the number of COVID-19 cases in the country. And we have been trying to combat this disease for more than a year now. As healthcare workers, we are being challenged physically, mentally, emotionally, and spiritually as we deal with these patients. And sometimes this disease affects us personally as well. And thus, tonight's topic is very timely. Our speaker for tonight is a fellow of the Philippine College of Physicians and a fellow of the Philippine College of Chest Physicians. He is also a fellow of the Bronchoesophagology Association of the Philippines. He is the founding and last chair on the Council on Health and Integrative Medicine of the Philippine College of Chest Physicians. He's an emeritus medical consultant at the Davao Doctors Hospital. He is retired from clinical practice and has endorsed his patients to his daughter, who is also an internist and a pulmonologist. He is an associate professor of the Davao Medical School Foundation and has been teaching mindful medical practice for the past 6 years. He has had lots of training on mindfulness-based stress reduction at the University of Massachusetts Medical School in New York and Boston. He also had completed advanced workshop in mindful practice by the University of Rochester Medical Center held in New York. And he has attended multiple retreats and workshops under Thich Nhat Hanh, Ajahn Brahm, Shamash Alidina, John Kabat-Zinn, and Saki Santorelli. He has been a lacto-vegetarian for the past 37 years for spiritual reasons, and you may contact him through the sites below. So ladies and gentlemen, without further ado, please help me welcome my father and our speaker, Dr. Parkash Mansukhani.
Hello. Hi. Thank you, Radha, for your kind introduction. And good evening, Eileen. Good evening, Iris, and good evening, Joanne. Thank you for coordinating and making this happen. And in the introduction, it mentioned there that I've retired from clinical practice for the past 5 to 6 years, and I've endorsed my patients to the very capable, and you've seen already her, it's Radha Siliano Mansukhani. So we can start off with the first slide. There we go. Okay. So is that clear, Raj? That's okay. Slide's clear.
Yes, yes.
Okay. So this is the title of the talk this evening. It's Building Resilience for Healthcare Workers During the COVID-19 Pandemic and Beyond. Seeing the picture of Buzz Lightyear there, you will have an inkling that this talk is going to be both informative and at the same time entertaining as well. The outline for the talk, we're first going to explore recent data on mental health disorders and burnout among healthcare workers during the COVID-19 pandemic. We will discuss strategies on how to cope with stress and build resilience during the pandemic. And we will focus on short mindfulness and self-compassion practices, which you can easily apply in the workplace, in the front lines. And we will end by watching a 5-minute video, which will make you smile or laugh, but only if you have a sense of humor. That's a little joke on my part. Okay. So the past year and a half, close to a year and a half, has been really challenging for us healthcare workers in the front lines. No? You can read for yourself the different challenges that we may have faced. You may be able to relate to some or all of them in different times of the pandemic, including isolation from family members, most other things. Eileen and Iris mentioned about the increased workload, stress, and burnout, illness or death of family, friends, and colleagues which may have lost, okay? Including stuff such as mistrust and hostility towards healthcare workers and the need to adapt to new technology, including telemedicine. And this has been especially true in countries with low and middle income, which includes the Philippines, of course. Now, there have been glimmers of hope and comfort as well. It's not all negative. And this would include the spirit of teamwork, support from institutional and government leadership, celebration of lives saved, public's acknowledgement of the value of healthcare workers, social media as a venue for healthcare workers to share information and their plight, their suffering, normalization of conversation about mental health, and this I thought were interesting as well. It caused us to re-examine our perspectives on life and death. And with the COVID pandemic, I think most, if not all of us, now have greater appreciation for people, activities, and things which may have taken for granted. And the pandemic has shown us how interconnected the world is, people, animals, nature, and the environment as well. So we are interbeings, we're connected to the pangolins and the bats and the caves, including pollution, which has eased during the time of the pandemic. Now, this study by Rodenska, which came out September 2020, lists factors associated with mental health outcomes in healthcare providers during the COVID-19 pandemic. There are 8 of these factors. They include limited resources of hospitals, threat of exposure to the virus as an added occupational hazard, longer shifts, disruption of sleep patterns, work-life balance or imbalance, subsequent heightened dilemmas regarding patient duties versus fear exposure of family members, neglect of personal and family needs with increased workload, and lack of sufficient communication and updated information. According to the study, all of those factors have been identified as main contributors to increased physical and mental fatigue, anxiety, stress, and burnout. And according to Marzetti et al., exposure of healthcare providers facing patients' physical pain, psychological suffering, and death make them more likely to develop secondary traumatic stress, also known as vicarious traumatization. These are 2 studies, 2 systematic reviews which were published this year. They looked at pooled percentages of the different mental health disorders that they studied. The first study is by Maxime M. et al., and they studied studies around the world. And the second study looked at studies which were done in Asia. The incidence of anxiety is about 30.1 in the first study and 25.9. These are food percentages in the second study. Depression, 31%, 27.2%. Sleep disorders or insomnia, 44%, 35%. Acute stress, which was studied in the first study, 56.5%. And post-traumatic stress of 20%. And fear, which was fear of contracting COVID and spreading to family members, was 77% in the Asian study where it was actually studied. Now, there are two cross-sectional studies which looked at the incidence of burnout and other mental health disorders, which were published in 2021 or this year, one by Halili et al., the other by Denning et al. And they found out that burnout occurred in 53 to 67% of respondents. The study by Denning et al. Looked at mental disorders, and the percentages for probable major depression was 13.9%, generalized anxiety disorder 15.6%, post-traumatic stress disorder similar to the 20% of the systematic reviews, so it's about 22.8%, and alcohol use disorder of close to 43%. Now, I found this article by Zais et al. Interesting. They looked at 4 categories of interventions addressing mental health issues in healthcare workers during pandemics and the previous epidemics as well. I think this would be important for us to be cognizant of this, so we will see if our institutions, the workplace, the hospitals we are working in have actually have these interventions in place, or how they can be improved upon in our institutions. So the first of the 4 categories are informational support, which includes training, guidelines, preventions, and programs. Instrumental support, which includes PPEs, protection protocols. Organizational support, the allocation of manpower, working hours, reorganization of facilities and structures, and provisions of rest areas. And emotional and psychological support, which includes psychoeducation and training, mental health support team, peer support and counseling, therapy, digital platforms, and telesupport as well. Resilience is defined as the ability to maintain personal and professional well-being in the face of ongoing work stress and adversity. Not only bouncing back or bounceability rapidly after challenges, but also going stronger in the process, which reminds me of the saying by Friedrich Nietzsche, "What won't kill you will make you stronger." Resilience is a bridge from burnout to wellness. The next few slides are from the Centers for Disease Control, and it's from an article entitled Healthcare Personnel and First Responders, How to Cope with Stress and Build Resilience During the COVID-19 Pandemic, which was updated December 16, 2020. You can download this article from their website for free. So the first thing to be aware of is to recognize the symptoms of stress you may be experiencing. This would include feeling irritation, anger or denial, uncertain, feeling nervous or anxious, feeling helpless or powerless, lacking motivation, feeling tired, overwhelmed or burned out, sad or depressed, having trouble sleeping, and having trouble concentrating, amongst others. These are some tips to cope and enhance your resilience from the CDC. The first is to communicate with your coworkers, supervisors, and employees about job stress. Talk openly about how the pandemic is affecting your work, identify factors that cause stress, and work together to identify solutions. Ask about how to access mental health resources in your workplace. Remind yourself that everyone is in an unusual situation with limited resources. So our common humanity, our shared humanity, all of us together in this pandemic. Identify and accept those things which you do not have control over, which brings to mind the Serenity Prayer, which goes, if you remember, to God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So the serenity to accept, the courage to fight for those things you can, and the wisdom to know the difference. So it's not a passive thing, it's a combination of an active and a passive or an allowing approach at the same time. Going back to the tips from the CDC to enhance and cope with resilience, recognize that you're performing a crucial role in fighting this pandemic and that you're doing the best you can with the resources available. Increase your sense of control by keeping consistent daily routine when possible, ideally one that is similar to your schedule before the pandemic. Try to get adequate sleep, make time to eat healthy meals, take breaks during your shift to rest, stretch or check in with your supportive colleagues, co-workers, family, and friends. When away from work, get exercise when you can. Spend time outdoors, either being physically active or relaxing. Do things you enjoy during non-work hours. Take breaks from watching, reading, or listening to news stories, including social media. Maybe go on a digital break as well. Hearing about the pandemic repeatedly can be upsetting and mentally exhausting, especially since you work with people directly affected by the virus. And the last tips to cope and enhance your resilience. If you feel you may be misusing alcohol or other drugs, which includes prescription drugs, then don't feel shy or feel stigmatized to ask for help. If you're being treated for a mental health condition, continue with your treatment and talk to your provider if you experience new or worsening symptoms. And from the CDC, engage in mindfulness techniques such as breathing exercises and meditation. Which segues us to mindfulness. So mindfulness is the awareness that arises when you pay attention on purpose in the present moment, non-judgmentally, and with heartfulness. This is the opposite of being lost in thought, being absent-minded, being an autopilot, or just sleepwalking through life. Another succinct definition is by Richard Chambers: having your body and mind in the same place at the same time, being fully present, engaged, and aware in each moment. These are some key relevant features of mindfulness which would be relevant for our presentation this evening. The first is that it's a form of mental training in attention which develops awareness and focus, much like concentrating the rays on a magnifying lens. So with increasing awareness and focus, increase your concentration, productivity, efficiency in work increases, and your chances of committing error would also be less. It involves being non-judgmental towards whatever arises in the present moment with acceptance, non-attachment, and a sense of kind awareness. So you accept whatever comes in, the good, the bad, the ugly, the COVID pandemic, and its consequences as well. The practice allows you to step back in awareness, also known as metacognition in psychiatry, so that you can better attend to what is happening both outside and inside you. So as attending physicians, you are now aware of what's happening both inside and outside you as well. This way, instead of reacting instinctively to the situation, maybe being fearful or withdrawing from it, then maybe you can approach the situation with a wider perspective, with more clarity, with more insight, and with more wisdom. And that takes a little practice. And with even more practice, you come to realize at the visceral level that you are not your thoughts. So it's more than you can think or think that you can think. That's something to think about. All right. One way of stepping out of autopilot or sleepwalking through life, just going through your systems without being really present, is by coming back to our senses. And coming back to our senses helps us come back to the present moment. So the go-to or the home base in mindfulness are the physical sensations of the breath in the body. Another way to come back to the present moment through the senses is by coming back to the sounds we're hearing right now in the moment. The sensations on our hands and our feet right now, the sights we are seeing, what we are tasting and smelling in the present moment. The corollary for that in the medical profession would be observing what you're observing right now, what you're inspecting right now, palpating, percussing, and auscultating in the present moment. Coming back to your senses in the here and now. You can ask questions like, where's my breath right now? That will bring you back to the present moment. Or where are my feet right now? That will get you out of your head and bring you back to your body. So you're now more embodied rather than being disembodied when you're lost in thought, being on autopilot, or sleepwalking through life. Now, the challenge in mindfulness is to remember to be mindful. And the way to do that is by doing formal, informal, and mini practices. The formal practices can be done lying down, sitting, standing, and moving. Informal practices are everyday activities which are done with the attitude of mindfulness, taking a shower, so eating. If you're religious, you can even pray mindfully as well. The other type of informal practices are called habit releasers, where you modify your routine activities, like how you brush your teeth, what you order in your menu, and maybe even modifying your routine activities or habits you may have developed during video conference. And micro or mini practices are done periodically throughout the day to check in with yourself, to see if your body and mind are in the same place at the same time. So we're going to be touching very briefly on one of the formal practices, it's mindfulness of breath. We will be discussing more of our informal practices and mini practices, which can be more readily applied in daily life. So mindfulness of breath is one of the core practices in mindfulness. And what we're going to be experiencing in the next few moments will just be mindfulness of 3 breaths. So what I'd like to do is we will be focusing on our abdomen expanding during inspiration and deflating or contracting during inspiration. For those of you who may not be familiar with diaphragmatic breathing, you can put your hand in the lower abdomen, and on the in-breath, feel your abdomen expanding, and on the out-breath, feel your abdomen gently deflating or contracting. So that would be diaphragmatic breathing. So when your diaphragm contracts, it moves downwards and pushes your abdominal contents downwards and outwards. So in inspiration, your belly expands, and on expiration, your belly contracts or deflates slightly. So we're just going to be doing mindfulness of 3 breaths. This is not going to take a long time. I invite you to adopt a posture that's upright, okay? A posture that embodies a sense of dignity, wakefulness, and ease. Okay? Now you can close your eyes for this practice, or just lower your eyes and keep it unfocused about 4 to 5 feet in front of you. This way you can better focus on the practice. Now let's bring our focus of attention to the physical sensations of the next in-breath in the lower abdomen. The gentle expansion of the abdomen in the in-breath, and the gentle deflation of the abdomen on the out-breath. So in this practice, we're not going to control, there's no need to try to control the breathing in any way. The body knows how to breathe itself. It's not thinking about the breathing, but just the bare sensations of the breath in the lower abdomen. Now let's bring our attention to the next in-breath with a gentle expansion in the lower abdomen, and our attention to the out-breath with a gentle deflation in the abdomen. If your mind wanders off to other sensations, thoughts, or emotions, that's okay. That's what the mind does. Just gently and kindly bring your attention back to the physical sensations of the breath in the lower abdomen. Now, as best as you can, let's give our full attention to the next in-breath as sensations in the lower abdomen, and the next out-breath, the sensations in the lower abdomen as well. Now, it's okay for you. You can have a gentle smile in your face as the short practice comes to a close, and maybe reminding yourself that the breath is always available for you to ground yourself in the present moment as you proceed with your life moment by moment and breath by breath. So if you had your eyes closed, you can open your eyes, raise your eyelids if you had your eyelids lowered, and welcome yourself back to the present moment. So one breath takes about 5 seconds. So if you do just 3 breaths, it will be 15 seconds, and this can easily be applied in the workplace, in the front lines as well. Okay. Now in the open forum, maybe if you have some questions about the instructions, feel free to ask that in the open forum, or maybe you can type it in the chat box and we can address it in the open forum as well. Now it's very important to weave the practices in daily life in our everyday activities. And you do that by taking cues, no? Or by making cues. Otherwise, you'll forget to do the informal and the mini practices. So you have to have cues for the practice, and you can divide them into practice in the beginning of the day, in the middle of the day, and towards the end of the day. So some cues for practice at the beginning of the day would be when you wake up in the morning. Okay. So there's waking up and there's waking up. Now that's what mindfulness is all about, being able to wake up in the present moment. Okay. So when you wake up in the morning, maybe you can be mindful of what's going on in your mind right now. Okay. Being aware of what's going on in your mind, being aware of what your body feels, being aware of the light as it comes into your room, or the darkness, if that's still dark, and this will ground you in the present moment. And you can do this, you can do mindfulness of the breath, maybe 5 breaths, or just 5 breaths when you wake up in the morning before proceeding with the rest of the day. Another cue would be when you take a shower. So in the shower, are you really in the shower? Or maybe you're thinking about what you need to do for the rest of the day. Maybe think about the past or thinking about the future, and you're not really present to the sensations when you're in the shower. On the average in the US, it takes them 8 minutes. I don't know why the data for this to take a shower. So that itself can be a mindful practice, a mini mindful practice for you when you take a shower. Another would be brushing your teeth. So this can be the sensations. Okay, this can be a practice for you in the beginning of the day, the sensations of the toothbrush on your gums, or you can make it a habit releaser as well. So if you're used to brushing the right upper quadrant, brush in the right and the left lower quadrant instead. This way you break your habit and become more mindful while doing the practice. Now, these are some cues for the middle of the day. So you're now in the hospital, you're faced with your patients, you're in between patients right now. And it's important, the middle of the day, to reset, to recalibrate, to reboot, to retune your mental instrument, or psychologically disinfect yourself before the next patient. You may be carrying a lot of negativity. You may be carrying a lot of anguish, fear, maybe some resentment, some conflict, no? And you may be carrying this over to the next patient. So it's very important to psychologically disinfect yourself before the next patient. One way to do that is while walking to the next patient, come back to the sensation on the soles of your feet. So this way, you disengage from your head, come back to your body, and this will give you a better insight as to how to proceed with the next patient. You can do the stop, breathe, and be mini practice. This is relatively easy to do again. So just stop what you're doing for a little while, come to an external stop, but make it an internal stop as well. That's a bit hard to define, but you know what an internal stop is. Maybe take 1 or 3 breaths mindfully. Again, not thinking about the breathing or controlling the breathing, but just the bare physical sensations of the breath. If you're not as mindful with the first breath, maybe more mindful with the second breath, and as much mindfulness as you can muster on the third breath. And just be with whatever centeredness, equanimity, or calm that you find in that moment, and see if you can extend that sense of peace and calm to the next moments of your practice. Now, don't worry, that's not going to last forever. Nothing lasts forever. That's going to fade. But rest assured, if you come back to your breath, it will be available for you in that moment as well. Knocking practice. So before going to the patient's door, you feel your hand knocking on the door, and this is a somatic. This is a somatic practice. Your haptic touch there for computers. So in the computers, the haptic touch there, and this stimulates your temporal zone at the same time. So it gets you out of automatic pilot and brings you back to the sensations of knocking in the here and now. The iris practice would be when you're with your patient, you look at your patient's iris and come back to the color of the patient's eyes or the patient's iris. This will bring you back in the present moment. Again, these are cues that you can experiment with and see which ones you're more familiar, which are more comfortable with you, which you can apply to bring you back in the middle of the day. Another practice is called smiling practice, and we all wear masks. This is smiling, with your eyes or smiles. And when you do this, it changes your attitude, it changes your demeanor, it brings you back to the here and now as a cue, and you're actually smiling with your eyes and looking at your patient. After the COVID pandemic, this is a beyond practice, maybe putting your hand on the shoulder of your patients, which will bring you back to the here and now. Okay? Sitting beside the patient, after the COVID pandemic, or sitting in a bedside chair beside the patient. And the stethoscope practice, or whatever your specialty practice is, ophthalmoscope practice, an otoscope practice, no, or a tuning fork practice, would be just to come back to the sensations of hearing when you're listening to the patient's heart or the patient's breath sounds. Will bring you back to the present moment. Okay? And will disconnect you from whatever fear, anguish, and other negative sensations you may be bringing over from the previous patient. Hand washing can also be a cue for you to be mindful. So being attentive to the sensations on your hand in the middle of the day when you're caught up with so many things on your plate. Okay? And you can integrate counting 20 or 30 seconds, or even singing Twinkle, Twinkle, Little Star, or Happy Birthday twice while doing the practice. Putting and taking off your PPEs can also be a cue in the middle of the day. You cannot, of course, make these two a habit releaser, right? You have to be very mindful when doing these two practices to prevent the spread of infection. If you're not mindful while doing them, then the infection control measures will be compromised, and you and your patients and loved ones may suffer as well. The stop practice in the middle of the day, you can do this, no? Periodically in the middle of the day, maybe you get to work in the middle of the day and maybe before going home from work as well. You just stop, and you know how to stop. Take 1 or 3 breaths, you know how to do that, and just observe whatever body sensations you're feeling, whatever emotions or thoughts are going in your mind, and just observing them come and go as best you can without getting so caught up in them, by just stepping back in awareness as best you can. And proceed, P would be proceed with awareness and kindness, or choosing to pick how to proceed. Proceed by asking yourself, what's the next best skillful thing to do right now? Okay. Halt throughout the day to find out if you're hungry, angry, lonely, or sad. And if so, then take the necessary measures to address these concerns as well. Now, for the end of the day, there are certain cues which are important. There are boundary rituals which are important towards the end of the day, so that you do not bring whatever you were experiencing in the hospital back home. And this can be detrimental with regards to your relationship with your loved ones, your family members at home. So boundary rituals would be becoming aware, say, for example, when you pass through the final threshold of the hospital door, if you're going out to the ER, whichever the final door is, that can be a cue for you to practice. And you can say to yourself, say, for example, I'm leaving hospital concerns behind and I'm about to step into the world of my family. I think some of you may already be doing this, no? And so that can be a mindful practice as well. No? Getting through the garage and putting your hand on the knob on the door of your house, feeling your feet on the steps, so you're coming back again to the present moment with the sensation on the doorknob, your feet on the step, on your door, and maybe telling yourself, I'm entering my house where I want to bring love, presence, and openness. Another cue for the end of the day would be when you lie down in bed before falling asleep. Okay. This is not strictly a mindfulness practice, more in the realm of positive psychology, but very powerful. You can be grateful for 3 things that went well in the day. So it can be something that went well, something that's okay that you take for granted, that you're still breathing. Okay. Otherwise, an abnormal sensation of breathing would be dyspnea. Okay. Doesn't have to be anything grand, that you're still alive. Okay. And something that didn't go well, but for a reason. In 2020, this is by 2020 hindsight, and this will teach you things along the way as you proceed through life. So the first would be something that went well. The second would be something that's okay, but you take for granted. And the third would be something that didn't go well, but serves as a lesson in life. So that's okay too. So just 3 things to be grateful for before going to sleep at night, and it doesn't have to be anything grand or earth-shaking. This actually brings to mind a saying by the Christian mystic Meister Eckhart, who says that if the only prayer you say in your life is thank you, that would be enough. Now, in the thick of things, you're facing, it's chaotic in your mind. The times before with no N95 masks or PPEs were available, long work shifts, feeling really overwhelmed in your work. These are some things that you can do to bring you back in the here and now and get you out of that chaotic mind state that you're in. As an emotional stopgap, you can do emotional detachment. And I think we do this as health practitioners, right? We detach ourselves temporarily from whatever we're feeling so we can be more effective while dealing with our patients. But this is just a temporary stopgap, and it's not going to be very productive as a healthcare worker. Okay? When you're emotionally detached to the max, you won't be able to care as much as you'd like for your patients. And also, not only that, when you do not process your emotions in that time for a long period of time, you embody these emotions, and you may bring these emotions home as well. And this can be harmful for your relationship with your loved ones. It's also important to think of things, to know your limits and ask for help, even for just a 5-minute breather. Maybe go to the comfort room and scream your head out. But you'll be surprised, there's always somebody around who can cater to that request. You'll be surprised how the universe rearranges itself sometimes. Vagal breathing. Okay. Now, when you're under stress, what happens? It stimulates the sympathetic nervous system, the sympathoadrenal medullary system, and the hypopituitary axis, which gets you into the fight, flight, and freeze response. Vagal breathing, also known as diaphragmatic breathing or abdominal breathing, stimulates the parasympathetic nervous system and puts you in the rest and digest response. Okay, so slow, deep breathing stimulates vagal breathing. And there are a couple of ways to do this. There are others down the line. There are two which I'm familiar with. The first is by Daniel Goleman, who's the one responsible for spreading emotional intelligence in the world. And his process is as follows. Inhale deeply through your nose so that your belly moves out in your lower abdomen. Again, the diaphragmatic or abdominal breathing we talked about. Hold your breath for as long as it's comfortable and exhale very slowly. And he advises doing this 6 to 9 times. Okay? So this will get you out of the panic mode, of the fight, flight, and freeze mode, and it will bring you to the parasympathetic response of the rest and digest response. Another way of doing it has been popularized by Tara Brach. This is take a full breath, count to 5 with the inhale, and count to 5 with the exhale. With the exhale, intentionally release tension and repeat for at least 3 times. So count in for 5 seconds, count out for 5 seconds, telling yourself with the first breath to relax. With the second breath, maybe tell yourself to relax some more. And with the third breath, telling yourself to relax completely. Okay? So it combines vagal breathing with affirmations, affirmations as well. Now, other things you can do in the thick of things would be to take a moment to name the challenging emotions. So in mindfulness, we do not run away from the challenging emotions or the situation. We step back, and one way to step back is to name the emotion so that you can tame it. So let's do this very simple practice, right? Say to yourself right now, I'm feeling sad. Notice how that feels like. I'm feeling angry, maybe with all the facial expressions. Say and feel to yourself, I'm feeling depressed. So notice how that feels like, viscerally, how that feels like in yourself. You can combine all three. I'm feeling sad, feeling angry, and feeling depressed. Perfect storm. Okay. Now, let's try this instead. No? Instead of imbibing those emotions, say this to yourself instead. Right now, I'm feeling this emotion of being sad. Okay. Notice the difference. Right now, I'm having this emotion of being angry or feeling angry. Right now, I'm experiencing the emotion of being, or the state of being, depressed. Notice the difference. Okay. The first time we went through those emotions, we were actually relating from the emotions. Okay. So we were so embroiled in them, we were so caught up in them. But once you step back and name the emotions, instead of relating from them, you now relate to them so that this engages you from it, and that tames the emotion to some extent. And this way, you're not so caught up in the emotions and can proceed with more clarity, with more insight, with more wisdom. These three are interrelated, and we're going to talk about them in the next few slides. So self-compassion, break, rain, and the anchor phrase. Compassion. I wasn't sure if I was going to do this, but again, we'll do it. We've done this before, okay? So what I'd like you to do now, there's going to be a twist. We've done this before. For those of you who have attended my sessions in the past, we've done this before. But I think it's important that we get reminded of it and practice it as well, and maybe more often than not, okay? And what I'd like you to do is to unmute your mics, okay? Okay, so everybody unmute your mics. You don't have to put on your video, just unmute your mics, okay? Because after doing this very short practice, no, we don't need to close our eyes for this. We're going to recite the other Serenity Prayer together. Okay? What I'd like us to do is extend our hands outwards, our arms outwards, with the palms facing each other. Okay, everybody with me? Extend your arms with the palms facing each other. Okay, all right. Can you see my hands? Okay. Wrap your arms around yourself, okay, and give yourself a big hug. Okay. When was the last time you hugged yourself? So don't stop hugging yourself. Don't stop hugging yourself yet. Let's repeat the other Serenity Prayer together. Okay. Wait. Everybody unmute. Okay. So let's repeat this together. God, grant me the serenity
Stop
Beating myself, not
and courage
courage
to
to forgive
forgive
myself
myself
as I'm
and
working
more
on doing better and doing
more
better
with
on
the
me.
just the way
The way I
ready love, just
the
the way I am.
the way I am.
I hope that. You can substitute God with the universal intelligence or whatever your spiritual practice is. No? How does that feel like? Different from the usual ways of doing things. Okay? So you can mute your mics now. You can mute your mics. Okay? So everybody mute your mics. That's me for now. Okay? All right.
Check your mic.
Ay, inano niya.
Kaya nga, mute and video.
All right, there we are. Okay, is that fine? Joanne, is that okay?
Yes,
There we
Doctor.
go. All right. So it's important to hug yourself. The American Holistic Medical Association, their motto is hug seal. So after the COVID pandemic, it's important to hug our loved ones, hug your patients appropriately, of course. No, it's important to hug our loved ones while they still allow us to do it, and while you still can. No, some of us may have lost our loved ones during the pandemic, so it's very important to be hugsy-bugsy while with your loved ones, and that's what my wife and I practice as often as we can at home. Okay. All right. Now let's talk a little bit about empathy and compassion. That's important because the difference is important when you're talking about fatigue. Okay? So empathy is viscerally feeling what another person feels, while compassion is translating that feeling into action. So it's more of a verb with the intent of contributing to the happiness and well-being of others. Okay? Now empathy, when you empathize with someone, motor neurons get set off in the brain, and studies by Richie Davidson in the university in Madison University Medical Center in Madison and Christian Neff has seen that motor neurons get stimulated when you do a functional MRI in these patients. No? And with compassion, there are different neurons which actually get activated when people are compassionate. Okay? So empathy is very draining. No? Motor neurons get activated. You get to feel what the other person feels. It can lead to fatigue. Compassion, on the other hand, not only stimulates different neurons, but stimulates the motor cortex so that you translate that feeling into action. And compassion is actually energizing. Okay? So it's actually empathic fatigue and not compassion fatigue. So that's a misnomer, which people like Richie Davidson and Christine Neff want to emphasize. No? So compassion is energizing, while empathy alone is draining. Okay? All right. So self-compassion means taking a perspective towards yourself as you would with a friend or colleague who is facing a setback or challenge. The analogy here would be when the oxygen mask drops in the airplane, you first have to take care of yourself, because if you conk out, then you won't be able to take care of other people. So for you to be loving, for you to be kind, for you to be forgiving, for you to be compassionate, you have to start with yourself before you can give what you have to others. Now, Christine Neff has done a lot of work in compassion, and she's identified three elements, or three components of self-compassion. The first is mindfulness, and no wonder. It involves recognizing when we're stressed or struggling without being judgmental or overreacting. Connectedness, remembering that everyone makes mistakes and experience difficulties at times, that we are not alone, the shared humanity, the common experience, the COVID pandemic that we have. And self-kindness, being supportive and understanding towards ourselves when we're having a hard time, rather than being harshly self-critical. And these are the three components which are very important in the short self-compassion break, which is by Christine Neff. So I'd like you to listen to her short 5-minute self-compassion break, which you can follow along with her audio, and which you can download from her website for free as well.
This practice is...
Sorry about that. Here we go.
This practice is called the self-compassion break, and it's something you can do anytime during the day or at night when you need a little self-compassion. So to practice this exercise, we actually need to call up a little suffering. So I'd invite you to think about a situation in your life right now that is difficult for you. Maybe you're feeling stress, or you're having a relationship problem, or you're worried about something that might happen. I'd invite you to think of something that is difficult, but not overwhelmingly difficult, especially if you're new to practicing the self-compassion break. So finding a situation and getting in touch with it. What's going on? What happened? Or what might happen? Who said what? Really bring the situation to life in your mind's eye. And then I'm going to be saying a series of phrases that are designed to help us remember the three components of self-compassion when we need it most. So the first phrase is, this is a moment of suffering, right? We're bringing mindful awareness to the fact that suffering is present. And I'd invite you to find some language that speaks to you. Something like, this is really hard right now. Or, I'm really struggling. We're actually turning toward our difficulty, acknowledging it, naming it. This is a moment of suffering. The second phrase is, suffering is a part of life. Okay, we're reminding ourselves of our common humanity. Suffering is a part of life. And again, finding language that speaks to you. It may be something like, it's not abnormal to feel this way. Many people are going through similar situations. Right? The degree of suffering may be different, the flavor of suffering may be different, but suffering is a part of life, part of being human. And then the third phrase is, may I be kind to myself in this moment. And to support bringing kindness to yourself, I'd invite you to perhaps put your hands over your heart or some other place on your body that feels soothing and comforting. Feeling the warmth of your hands, the gentle touch. letting those feelings of care stream through your fingers. May I be kind to myself. And using any language that supports that sense of kindness. Perhaps language you would use with a good friend you cared about who was going through a very similar situation. You know, it may be something like, I'm here for you. It's going to be okay. I care about you. You can even try using a diminutive if that feels comfortable. You know, oh darling, I'm so sorry. Or you can try calling yourself by your first name. Anything that feels natural to express your deep wish that you be well and happy and free from suffering.
Okay. So let's break that down. That was a direct experience that you had. Let's break it down to a learning experience so you can apply it in daily life. Okay. So those are the three components. We mentioned that already. The first is, she said, this is a moment of suffering. That would be your mindfulness. Okay. So you acknowledge that it hurts. Ouch, this is stress. Suffering is part of life. No, that's one of the marks of existence. It's common humanity or shared humanity. Okay. Other people feel this way. I'm not alone. We all struggle in our lives. And the third component would be, may I be kind to myself, which is self-kindness. And you can repeat such words as she mentioned. May I give myself the compassion that I need. Maybe if you like, putting your hand on your chest or over your heart while saying this. May I learn to accept myself as I am. Forgive myself. May I be strong. Okay. All right. Okay. So Christine F. also talks about compassion and equanimity. So equanimity is very strong for us healthcare workers. Now we need to be in that equipoise state so we can better interact with our patients. And this is similar to the Serenity Prayer we talked about earlier. Okay. So this saying by this couple of sayings by Christine F. can be posted as a post note. You can put this on the bulletin board as well. And this is especially important when you're facing situations which seem to be hopeless. Okay? So she says that everyone is on their own life journey. You can say this to yourself. I'm not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like this are difficult to bear, and yet I will try to help if I can. Okay, so you can post this as a post-it note or in the back. No, you can have it in the bulletin board as well, especially in those times where you think you can't do anything more for your patients. No, you tried everything you could for your friends, your colleagues, your loved ones, your patients, and despite that, you seem to be losing them. Which brings to mind the saying by Hippocrates: "Cure sometimes, treat often, but comfort always," which is part of the prayer we had earlier on as well. Now, the RAIN stands for Recognize, Allow, Investigate, and Nurture. It's Michelle McDonald who's been actually credited for this, but it's been popularized by a lot of mindfulness teachers, a lot of other teachers as well, including Tara Brach, Dan Siegel, Jack Kornfield, and the others. So this is by Tara Brach, and she calls this the rain of compassion. Okay? So first is recognize what you're feeling. Okay, I'm feeling fear. Mentally whispering it helps right away. So that's naming it to tame it. Allow, just let the fear be there. Don't try to run away, fix it, control it, or judge it in any way. Investigate where in the body you feel that fear. Find out how it feels and breathe with it with a gentle quality of attention. Okay? So maybe you're feeling it as a tightness in your chest, maybe massage that area, or maybe you're feeling it as a sense of palpitation, or a tightness in the nape of your neck, no? Or a heaviness on your shoulders. Just breathe with it with a gentle quality of attention. And then you can choose to put your hand on your heart and offer a kind, soothing message to yourself. You can say to that fear, the pandemic, of spreading it to others, your loved ones, thank you for trying to protect me. It's okay. It's okay. You can also use an anchor phrase, which is a word or phrase that helps you stay connected to your intention to help you through a challenging moment, such as, it's okay. Yes, this hurts. May I stay open? May I be kind to myself? May I meet this moment with an open heart? It's okay, one moment at a time. This too shall pass. No? Nothing's permanent, another mark of existence. There are other practices that you can do as well. No? You can reach in or lean into your faith. It may be something spiritual, or maybe your faith in science, or both. This is a picture by our own Glenn Pono. Okay? Singing and dancing, no? Don't take that for granted. We are the karaoke capital of the world, I think. Okay? It says here, never underestimate the healing power of listening to your favorite music on full blast while dancing around the house like an idiot. No? Can be very stress relieving. And laughing practice whenever you can, whenever it's appropriate. So listening to comedy videos, which we will do after the Q&A, just a 5-minute comedy video at the very, very end of this presentation. Maybe you can listen to podcasts, comedy podcasts, when you're driving home from work, or remembering your favorite jokes, or remembering a joke that your grandchildren had or may had for you. You can remember the jokes that your friends have had for you, and this can certainly go a long way. So in one of the trips abroad, in one of the shops, this is one of the signages there. Unattended children will be given espresso and a free kitten. So you better attend to your children. So that's something that can be part of your positivity portfolio as well. Another thing you might like to explore would be mindful practice. No? And this is a program from the University of Rochester where I trained in. And the explicit aim of the program, which has been ongoing since 2007, is very appropriate, no? for the COVID pandemic. The explicit aim of the program is to help students and physicians who may find themselves in challenging circumstances approach patients with attentiveness and curiosity rather than fear and withdrawal, which is a common climate during the COVID pandemic. And the definition of mindful practice by Ron Epstein, who's a co-director of their program, the University of Rochester, and the author of Attending, which is a book I suggest you try to check out. No? It's a book entitled Attending, which is what we all are when we attend to our patients. So mindful practice, by its definition, should be moment-to-moment, purposeful attentiveness to one's own physical and mental processes during everyday work with the goal of practicing with clarity and compassion. So we've been teaching mindful practice. I've been teaching mindful practice the last 6 years to the 4th-year medical students of the Davao Medical School Foundation. So it may be something you might want to look into. Okay? So there are 12 modules there, and the first 5 are actually the ones which are required by the University of Rochester and what's being taught in the Davao Medical School Foundation as well. So if you fail to notice, then you miss out a lot. If you don't see the nonverbal cues, you may not pursue that line of reasoning or questioning with your patients, and you won't have a good history. How doctors think, if you're not aware of your stereotyping, your biases, your cognitive biases, then this can lead to a lot of errors. You may be the best clinician in the world, but not maybe the worst person, and so professionalism is very important. Self-care and burnout. So in the US, 1 doctor commits suicide every day, and this was before the COVID pandemic. I suspect it's probably going to be higher now. Okay? And it's been a public health crisis and an issue in the US as early as 2015, 2016. And how to be with suffering, which is never taught to us in medical school. And certainly we see a lot of suffering day in and day out during the COVID pandemic. Okay? So this would be the curriculum for students and residents. We have a slightly different curriculum for clinicians. Okay, so that was my last slide. You can reach me through the following email and through the website. There's an overlap there, okay? And we will have a 5-minute funny or comedy video at the end, towards the very end. If you want a copy of the slides, you can email me. If any other questions, you can email me as well. So we're now open for any questions in the live Q&A as well as in the chat box as well. So Radha, take it away.
Yeah. Okay, thank you, Dr. Mansukhani, for the very enlightening lecture. I guess basically we have to first identify if we have any of the symptoms of stress, burnout, talk to those who are within our group and identify how to deal with these problems, and take a break and return back to ourselves. So I think that's the basic gist of everything. Are there any questions from the group?
Things which are not clear, some questions, maybe some practices that you do, which have integrated into your practice as well, in terms of building up resilience.
Can I raise a question?
Yes, please, go ahead.
Go ahead, Dr. Kuching.
Yeah.
Bong.
In evidence-based medicine, kasi, sir,
Yes,
one of the areas that's really difficult to tackle is measuring quality of life. Like, how can you measure happiness? Because that's so subjective. But it's a phenomenon, it's real. It's something that you cannot challenge, you cannot go against. When a patient says, I'm happy as it is right now. And I know that there are studies that have linked mindfulness to hard endpoints. I've read them. Ang issue is doctors really don't have enough opportunities to learn the techniques of mindfulness. And one of it actually comes to mind every so often when we're exposed to patients who's like, we know who is highly stressed, especially now with the pandemic. I probably issued a lot of anxiolytics in the first 30 days when we resumed clinic in May. Maybe for the first 30 days, puro anxiolytics lang yung na prescribe ko. But it's difficult to initiate, to inject them in clinical practice if you're not trained like we're not trained like you. No, because it's a process. It's to me, it looks like, I think it's parang kailangan mo na ng residency training kasi it's being in it. It's not psychiatry. Psychiatry processes and the pharmacology is part of it. So parang it makes it easier. But there's the component of subjectivity and being mindful of who you are is a totally different perception between patients.
Right.
So how could you inject that in practice?
Okay. So you have a lot of questions there, Bon. All of them are very interesting and very relevant to our discussion. So the first was parameters, how to measure it, right? Now there are lots of, like, you have the mindfulness awareness attention state, which has been validated. So you can measure that before and after a program. Looking at happiness naman, some people shy away from happiness, but there are certain subjective and objective measurements you can combine to measure happiness. Some people now look at the PERMA model of well-being instead of happiness. So PERMA would be positive emotions, engagements, relationship, meaning, PERMA, positive emotions, relationship, meaning, and accomplishment, the PERMA model. Now, all of these can actually be measured, no? And there are scales to measure all of these things, no? In terms of quality of life parameters. So if you go to the University of Pennsylvania homepage, no? That's Marty Seligman's homepage. So you go to the University of Pennsylvania, they have all of these questionnaires which you can use, and you can take the survey yourself, and they're all for free. No? So I suggest you go to the University of Pennsylvania, the homepage of Martin Seligman, who's one of the co-founders of modern day or contemporary positive psychology, which is not positive thinking, by the way. Okay? So in positive psychology, wherever you are, wherever state of happiness you are, you can be made happier. So it's not disease-oriented, but wellness-oriented instead. So they measure those things in terms of well-being and not happiness, which is associated with a fleeting emotion. So it's more well-being that they're looking at. Okay. Now, in terms of mindfulness, it's not a quick fix, certainly. No, it's not a quick fix. You need to train for mindfulness. You need to train for like everything else. Brewed coffee is better than your instant coffee, usually, unless you're in a rush, right? So, with that being said, if you train in mindfulness, if you go through a program, then you can be better mindful of yourself. So it starts with yourself. No? Before you teach mindfulness, you have to have a practice of your own. No? If you don't have a practice of your own, it becomes artificial. It becomes very academic, and there's no sense of presence when you're with your patient. So you have to start with yourself. Okay, and once you do that, then maybe you can teach those things to your patient, like vagal breathing, say for example. That's very accessible, no? Like coming back to your breath. That's something that's very accessible. But again, it's very important that when you teach mindfulness to patients, you have to make sure that these patients have no significant active psychological issues at the present time. No? Because what happens when you become very mindful, and you especially like to do practices like mindfulness of breath, you'd be very aware of the thoughts that are going on in your mind. Your thoughts are always there, but once you start to pay attention to them, and if these thoughts are very negative, they can lead to self-defeating and bad behaviors. No? So it's very important that these patients are psychologically sound. If they have major psychological issues, they have to have them get a clearance from psychiatry before I train them in mindfulness as well. Okay? It's not easy, no? It's not like mindfulness. Well, mindfulness is simple, but not necessarily easy. Now, the thing is that there's so many distractions for us to be mindful. No, you have consumerism, you have mass media, you have the suffering of people, you have the pain that you see every day. So it's very easy for us to be mindless, no, or to be lost in thought and not be in the present moment and think of the next patient or the previous patient which we had. No? Now, again, with practice, that's what's important. The practice is important so it doesn't become a knee-jerk reaction. So before the next patient, take a couple of breaths. You try it, see if it works out for you. The invitation in mindfulness is to try it out for yourself. If it works, fine. If not, do something else. There's nothing hard sell in mindfulness. So I think it's more of a practice. You have to develop the practice so you can become more mindful. And nobody can be mindful 24/7. No? There's no such thing as a perfect mindfulness guy. And it's different each time. It depends on what's going on in the present moment. If you have a death of a loved one, maybe a significant life event, then it's very hard to be mindful at that time. When you go to sleep, you can't be mindful either. Your thoughts would still be there. No? But you just do the best you can with the attitude of heartfulness, not only to others, but to yourself while doing the practice. And it becomes different each time. And when you practice, and it takes a little practice, you will notice that each breath is actually different from the next breath. So it's never a dull moment. I hope I answered your question, Mo. Feel free to follow up or ask more questions.
I have a follow-up question if there's no one asking.
Yes, please, Mo, please.
Go ahead.
The Q&A is very interesting usually. Mo, go ahead.
Apple Watch has an app.
Yes,
for mindfulness.
Right.
Is that something that we could start with?
Right. So there are lots of apps that you have which you can download for free from the internet. If you want to get, the mindfulness apps are good as a start. No? But if you want to get deeper into it, I think the one-on-one would be good. But however, we can't do that right now. No? So the best thing would be a one-to-one, a face-to-face, which we can't do really readily now. Then you have the online courses available. If you want a free online course, it's an 8-week. The standard course is 8 weeks. No? So the free online standard course of 8 weeks would be the Palouse Mindfulness. You go to their website if you're interested. So in your spare time, you can get into it. It's Palouse Mindfulness. So Google that and you can access their course for free. The best, I think, would be the mindfulness-based stress reduction program, which is a gold standard where all the studies have actually been, where most studies have been done. And this is from the work of John Kabat-Zinn and his co-workers. No? The head of that program now is Judson Brewer. So after John, it was Saki, now it's Judson Brewer. So that's from the University of Massachusetts Medical Center. Okay. Now these apps have been shown to be effective, but not as good. But certainly it's a start. It's a start, especially now during the pandemic. So you can download other things like Headspace, you can download Calm, and see if it works out for you. So try it out and see if it makes a difference. Sometimes you won't feel the difference right away, but the other people in your environment, your loved ones, can feel it. Oh, what have you been doing? You seem to be more calm, more relaxed now, more forgiving, more funny now than before. And maybe they're the ones who can notice it more than you do.
Thank you, sir.
So I hope that answered it. But try it out. Since version 10.1, I think, or 10, yes, Apple has had the mindfulness app there as well to remind you to be mindful. Maybe take a couple of breaths. It's as easy as that. No? and drop into yourself. Just drop into the moment, much like a tennis ball, and just drop in the here and now. It's just a change in the way you pay attention, a shift in the way you pay attention from paying attention to your head or what's going on in the past or future, and just drop in. It can be as simple as that. And you're back in the present moment.
Okay. Thank you, Dr. Mansukhani, for answering Dr. Kuching's question. We have another question here from Dr. Caroline Bernadette Kinkay Ignacio. There are so many techniques to use, but if you are very busy with all that's happening in your life, where do you suggest we start? What is a good stepping off point?
Okay. Well, I described some cues, the informal and the mini practices, no? Which you can start already when you wake up in the morning. No? So this is a mini practice. This is a mini practice, no? When you brush your teeth. So you don't need any special equipment. You don't need to enroll in a gym. You don't need any special, you don't need it. You don't need a special place for doing that. You don't even need a yoga mat. You don't even need a special zabuton or a chair to sit down. You can do it in a simple chair. No? So there's so many choices that you have to start. No? So you have the formal, the mini, and the informal practices. So start with the formal and the mini practices. If you want to get into a program, then there's so many available online. If you want to get into the MBSR program, you can go to Sounds True as well, but you have to pay for that. No? And if you go to the MBSR program with John Kabat-Zinn in the University of Massachusetts, that costs a certain amount of money as well. But that's certainly something that you can explore. I mentioned Palouse. If you have the time, that's an 8-week program. Standard program in mindfulness is actually 8 weeks. So you meet once a week for 8 weeks, just once a week lang naman, and you're given assignments which take about 45 minutes to 1 hour to do because you need to apply mindfulness in daily life. If you can't apply it in daily life, forget it, do something else instead. That's the litmus test in mindfulness. No? And the MBSR program says that as long as you're breathing, there's more right with you than wrong with you. That's the starting off point. No? So there's so many resources and online sites that you can get into. So the University of Massachusetts Medical Center would be my favorite, and I've trained with the group of John Kabat-Zinn as well, and they're the gold standard. They've had most researchers done by them. You have the Palouse, which is free, and there's so many other centers in the States, no, which offer mindfulness courses as well. In the UK, you have the Bangor University of the MBCT program. They're good in that, mindfulness-based cognitive therapy, which combines cognitive behavioral therapy with mindfulness. And this has been shown to decrease your relapse rates in people with severe depression with 3 or more episodes of relapse by 50%. So that's been integrated into modern day psychiatry as well. And if you go to UpToDate and you type in mindfulness-based cognitive therapy, an article there will appear by Zindel Siegel. So that's in the mainstream as well. So a lot of resources actually available. Okay. You can email me if you have any questions, and I can send you other suggestions as well. You can go to the website mindfulness.ph, and I think there are some sites which I recommend there as well, but that hasn't been updated for the longest time.
Okay. Are there any more questions? If not, then I think we can call it a night.
We have one more video, Radha.
Oh, yeah.
Radha.
Oh, yes, I forgot. Correct.
Right.
We have one video before we proceed.
Before we call
That's
it a
correct.
night, I'd like you to watch this video.
And,
right. So this
yes,
video,
and
this
maybe
video
we can also, shall
yes,
we do the closing remarks after the video?
You can do the closing remarks now.
Okay.
And then we'll
so let me now
video.
please call on our chair for advocacy, Dr. Jude Giang, for its closing
so wait
remarks.
for the video. Right.
Okay, good evening, everyone. So I would like to congratulate the Southern Mindanao chapter for this advocacy activity. And we know that mental health is important at every stage of life. It helps determine how we handle stress, relate to stress, and make healthy choices, especially in this time of pandemic. Having a good mental health is when you feel positive about yourself and cope well with the everyday pressures. So thank you very much, Dr. Parkash, for that very heartwarming lecture. And stay safe, everyone, and have a good night.
Okay. Thank you, Jude. Thank you.
Thank you, Dr.
And
Parkash.
yeah, to introduce, just to segue to the last slide, which is actually the video that I'd like you to watch. It's just a 5-minute video. So I'm going to share the screen and then you can watch it. I've watched this video so many times, no? and it doesn't cease to make me smile or laugh. And I hope it does that for you as well. That's if you have a good sense of humor, but that's just part of my joke, of course. No? And so I'd like you to watch and listen to this video by Rowan Atkinson. Okay, you probably have watched this before, but again, I hope it still makes you smile and laugh.
Hello. It's nice to see you all here. Now, as the more perceptive of you have probably realized by now, this is hell. And I am the devil. Good evening. But you can call me Toby if you like. We try to keep things informal here, as well as infernal. That's just my little joke. Now, you're all here for eternity, which I hardly need tell you is a heck of a long time. But I'm sure you'll all get to know each other pretty well by the end. But for now, I'm going to have to divide you up into groups, if that's okay. Can you hear me at the rack? Well, if you'd stop screaming, that would help. Okay, now, murderers. Murderers? Over here, please. Thank you very much indeed. Looters and pillagers, over here, please. Thieves, if you could join us. And lawyers, you're in that way. You'd like to come down there. Thank you very much indeed. Yes, there's plenty of room. If the hedge fund managers would just move along a tiny bit. There we go. Fornicators, if you could step forward. My God, there are a lot of you. You're down here, but first, if you could form a queue in front of that small guillotine in the corner there. Thank you very much indeed. The French. Are you here? Parfait. And the Americans. Yes, look, I'm sorry about this. Apparently, God had a little falling out with your founding fathers and damned the entire nation in perpetuity. He sends particular condolences to the Mormons, who he realizes put in an awful lot of work. Never mind, if you'd just like to come down here. Yes, if you'd just like to keep clear of that big space there, we're reserving for a Mr. Trump. Atheists. Atheists? Ah, you must be feeling a right bunch of nitwits. Come down here, please. No mind. And everyone who saw Monty Python's Life of Brian. I'm sorry, turns out God can't take a joke after all. They're good. And Christians. Christians? Yes, I'm sorry. I'm afraid the Jews were right. That would be lovely. Thank you very much indeed. Right, well, that's about it. Are there any questions? Yes. No, I'm afraid we don't have any toilets. I don't know if you read your Bible, but I'm afraid it's damnation without relief. If you didn't go before you came, then I'm afraid you're not going to enjoy yourself very much. But then I believe that's the idea. Okay, well, look, I'll see you all later at the barbecue. Or rather, on the barbecue. And generally, I just hope that you all have a terrible time. I'd like to leave you actually with another little joke of mine. I only know two jokes, informal, infernal, and this one. And this joke goes like this. It is, knock, knock. Who's there? Death. Death.
Okay. So everyone, keep safe, stay well, and be happy. Thank you.
Good night.
Thank you, Dr.
Good night.
Parkash.
Good night. Thank you.
Keep on laughing.
Thank you.
Bye.
Thank you.
Ada,
Good
thank you.
Night.
Thank you.
Thank you, Doc Jude. Thank you,